Hi, so today let's learn some of the tennis elbow exercises. So if your pain is somewhere here, okay, then you may call it a tennis elbow. Sometimes the pain goes so high that you can't even lift a cup of coffee or chai. So let us understand what all exercises can be done to release that. Well, before the exercises, let me just quickly mention that these are the few things that you need to do. First is icing, second is taking rest, and third is splinting, and fourth is the stretching and strengthening exercise. When you apply ice, it has to be covered with a cotton cloth and gently apply it all over the area where it hurts. This area generally becomes slightly painful and you can just slightly massage it with some moisturizer. More importantly, we need to find out what is the root cause of this tennis elbow, because probably you're not even playing tennis. So how did it come? It could be because of overuse of the mouse or just the holding of phone. Or if you're a doctor, you could be holding an ultrasound probe or maybe a phone or something that needs a lot of holding. So let's come to the stretches. So first and foremost, we just stretch like this, like this, like this. Okay, and then we start with a few exercises. For exercises, we can come at the edge of the desk and keep your hand at the edge of the desk maybe, so that you can easily observe the movements. You are also trying to avoid any compensation. So this is the first exercise. If you can see that I'm not holding any weight in the hands as yet. So initially, to begin with, just the gentle stretches and without weight exercises. In the second exercise, we keep the fist perpendicular to the floor and then raise it up. Okay, make sure you're just raising it up like this and not even bringing it down too much. Just bring it to the center and take it up. This will ensure that you will not have a false feeling of doing the complete range, but you will actually be taking it up properly. When you want to take it sideways, then again you will start with your hand straight and then just the sideways movement. So you can also do it on the table like this and just stretch like this as much as possible. Okay, if lifting like this is difficult, you can just do it like this, but again, if you can see, it is straight and then coming sideways. So for the tennis elbow, if you're wondering what all exercises to be done, so these are the few stretches. And in. Okay, so basically we move the hand in all the directions with your elbow straight and wrist stretch in all the directions. Hold it for good 10 to 30 counts and then relax. Now, how long should you be using the splinting schedule? Basically, the splint is meant to give it the rest and a little bit of compression, and basically it acts as a reminder that, see, you have some issue with your elbow and you don't have to overuse the muscles around it. So how long do you use the splint? You can use it for about 2 hours, then remove it. Do the exercises, the stretches you have to hold for at least 10 to 30 seconds. Don't have to repeat it immediately, but you can repeat it after every 2-3 hours whenever you remove the splint. The stretches and the strengthening exercises. And the strengthening exercise you also gradually increase with weights. So right now, if you're doing it without weight, continue doing that for a couple of days. Once you start feeling better and a little more comfortable with lifting, say, a 250 ml water-filled bottle, you can start lifting the same weight and increase the number of repetitions with that first, and then increase the number of sets for a few days, and then increase the weight of the bottle or the weight of the weight cuff or the dumbbell that you're using. Like we said, the splint actually acts as a reminder, and that just means that you have to wear it while you are using that hand. So basically, if you are, say, a sonologist or a gastroenterologist who has to use the hand for this particular movement, because otherwise you're not playing tennis. Not all of you are playing tennis to get the tennis elbow, right? But still you're getting it. So it's the overuse of that particular tendon, and that's why we have to first make sure that you're taking enough breaks, you're resting it enough between your official work, obviously. But when you're using it, then do wear the splint. Happy working!